Hey Shubham, this is Yashasvi from Health 2.0 conference. Very congratulations for getting recognized on our platform.
Hi, Yash. Thanks.
Can you please introduce yourself and the organization you're representing today?
Sure. So my name is Shubham Pandya. I am the co-founder and CEO of Tidbit, and we are a web app that is trying to help researchers help share their research to a wider audience using the power of infographics.
I see. That's really good to know that. If we talk about this industry, like the healthcare industry, how do you think this industry is transforming lives at a global scale?
Healthcare is probably the ones that is transforming lives the most out of any industry. But I would say right now, the invention and integration of AI is what's driving the next evolution in healthcare. And you
Right,
can see it across every aspect of technology. Uh, AI is using uh, technology such as transcription,
right,
uh, summarization, which is where we are, to help doctors and patients better understand, communicate, and streamline their workflows.
right,
There's aspects of VR technologies that are being used to train doctors and simulate environments to help them perform surgeries better and improve their rates. So I think the industry is. We can talk about this for days and days in terms
right.
of how it's
I get it. Right.
transforming it, but it's all very exciting.
I see. That's really good to know that. Other than that, like, how did you come up with the idea behind Tidbit? Like, what is this mission?
So the idea actually came as not just from one person, but there's three co-founders on the
Okay.
team, and so Sparsha, he is a doctor as of now, a resident doctor. Myself and Nilay Shah. So the three of us all are coming from different domains.
Right.
Sparsh was in had a passion for being more having a way for more people to receive information in a
Right.
concise format,
Right.
in a graphical format. He saw a trend emerging in the industry, and so he felt like that was something that we could, be a trendsetter for.
Right.
I myself really enjoy. I'm a curious individual. I like to learn things, but the technical barrier, limits me from understanding the more complex information. So my goal was to simplify information and make it easier for everyone to
Right.
understand that information. And then Nilay's uh, uh, part of the vision came around the veracity, the truthfulness, the lack of trusted content that's available on the web, and having a way for our content to be trusted because it is based on actual scientific research that's
Right.
published in academia. And so the combining the three of these visions of ours is what merged and gave birth to the idea of Tidbit.
I see. That's really good to know that. Other than that, like, how did it feels to receive recognition for your own accomplishments?
It's wonderful. It really is a true testament of the work that not just me but the entire team at Tidbit we've been doing for the past 3 almost 4 years now.
Okay.
And it's a good motivator. It's a great motivator for everything we've planned. It's a good validation, and it lets us know that we've done a good job. But it's still the first of many steps that we want to take, and this is just the start to where we
That's
want
the
to be.
start.
So it's definitely an unreal feeling,
All right.
and I hope to replicate this going forward.
Wonderful. That's really wonderful to know that. Other than that, like, what is your vision of like where you want to take Tidbit?
So Tidbit today is largely helping researchers and journals and publishers just streamline their workflows and reach a larger audience.
Right.
But the overall vision of Tidbit is for democratizing knowledge,
Oh,
essentially, if I wanted to summarize it in 3 words. But the idea is that even high school students should be able to understand the latest developments in healthcare, right?
right.
They might not understand the absolute technical understanding of what's being discussed, but they should be able to grasp the overall concept
Right.
to the point where they can build on it over time. And by doing that, we're actually making it easier for that knowledge and not locking it to a small set of audience. And that actually accelerates knowledge translation and sharing across the world instead of
Right.
limiting it for just those that are technically capable of understanding and communicating it.
Right, I understand. I understand that. Other than that, like if we talk about the conference, I'm sure you must have watched our conference virtually. So, what do you think about it, like our conference?
I thought it was a wonderful conference. I was able to listen to several keynotes that were there, and I thought the conference attendees were very, very knowledgeable, very, very interesting individuals from a variety of domains, and they're doing a lot of interesting things in various aspects. I thought it was wonderful to connect with a lot of the delegates that were coming to the conference, not just in person, but on virtual
Right.
networks. All right. And so having that sort of community being born out of the conference, I thought it was a wonderful experience.
I see. That's really good to know that. Other than that, Shubham, please tell us where we can find more about you or where we can find more about your organization.
Sure. So our website is www.tidbitapp.io, but you can follow us on any social media channels like X, Instagram, Facebook, LinkedIn, TikTok with the channel name at Read a Tidbit.
Okay. All right, that's really good to know that. Thank you so much, Shubham, for having me here. It was lovely speaking with you. And yes, next time, like I'll be more than happy to see you in our upcoming health conferences.
I hope so too. Thanks, Yash.
Have a lovely day. Bye bye.
You too. Bye bye.